Hello, my name is Dr. Catherine DeUgarte. I work at PFCLA in Los Angeles, and I have been a reproductive endocrinologist and infertility specialist for almost 20 years. I love helping patients have families either now or if they're not ready for families right away, they have the option of cryopreservation or freezing their eggs and or sperm and or embryos for future use. And then they can have kids later when it's a little more difficult given their age. Cryopreservation is the process of freezing either eggs, sperm, or embryos so that in the future, when especially women have lower number of eggs, they can still have their eggs frozen so that they can use them at a later time when they're ready to start a family. Most of my patients who come in for cryopreservation options are coming in for elective cryopreservation, so patients who are not ready to have a child right away but would like to have the option of having more than one child in the future. So they decide to freeze their eggs or embryos if they have partners, or they can freeze embryos with a donor sperm for the future. And in the future, when they're ready to use them, depending on how many they have, it's better to have a certain number of eggs frozen so that you have more choices for future families. In terms of medical versus non-medical indications for egg freezing, some of my patients unfortunately have a recent diagnosis of cancer, so they have to have their eggs frozen as soon as possible because they have to start chemotherapy or radiation therapy, which unfortunately puts them into menopause, and then they will no longer have eggs for the future. And therefore, some patients who come to me come for cryopreservation for medical reasons. However, a lot of my patients come in for non-medical indications. They're not in a relationship currently, or for example, doctors who are in the middle of residency and they have several years that they have to finish their training, and they're not ready to start a family, but they don't want to lose that window, and so they freeze their eggs for future use. One of the reasons why my patients like to cryopreserve their eggs for future use are patients who are transitioning from female to males, and so they need to start taking medications such as testosterone and other androgens, which can make it more difficult to freeze their eggs. And so some of the times that we cryopreserve eggs is so they have their genetic eggs frozen, so that if they're in a relationship in the future, they can choose to use their eggs that were frozen before they took hormonal therapy such as testosterone and other hormones for their transitioning process. Another reason for cryopreserving your gametes is you can cryopreserve sperm so that in the future, if you're going from male to female transition, you can have your sperm frozen. And so if in the future you can use that in case you have hormonal treatments, which can prevent sperm from being produced. For example, males will take estrogen, and sometimes they even have surgery, so they have their testicles removed, in which case they will not be able to produce more sperm when they're transitioning from males to females. And so freezing their sperm can have them have a genetic child in the future using somebody else's eggs. The science behind egg freezing is actually newer than you would think. Egg freezing has only been around in the US since 2012. It originated actually in Italy when they initially started doing egg freezing because the Pope was not allowing embryos to be frozen. And therefore they started doing egg freezing in Italy, and then it was initially considered experimental in the US, but since 2012 it's no longer considered experimental, and the technology has gotten a lot better. When we first started doing egg freezing, we were using a procedure called slow freezing, which is a process which took many, many hours to freeze eggs, and it wasn't as successful as the newer technology, which most labs are using now, called vitrification, where there's a process of fast freezing, or like flash freezing of these eggs, which is much quicker and much better in terms of egg survival. So since 2012, the technology has gotten better and better, and what I'm seeing right now is with the eggs that we freeze, about 90% or plus of them survive the freezing process. And so what happens is when we retrieve the eggs, by doing a surgical procedure called an egg retrieval, we give those eggs to the embryologist next door, and they look at them under the petri dish and they see which ones are mature eggs or which ones are immature eggs. And then we freeze them that same day or the next day if they need to grow another day by a process called vitrification. And they're frozen in little tubes called straws, and usually frozen either 1 or 2 per straw. And then we have carefully labeled them, and we freeze them in liquid nitrogen, and they can be frozen for many years afterwards. For my patients that desire to have a consultation and discuss the process of egg freezing, we usually start out by having a new patient consultation to discuss the process of egg freezing, to review the timeline and the medications used and any medical history. We want to make sure that they don't have any contraindications to egg freezing, and then they're not on any medications that should be discontinued before the process of egg freezing. So we do a consultation, we do an ultrasound to see how many follicles they have in their ovaries. If they're on birth control pills, we usually stop the birth control pills for a few weeks to see what their true hormonal values are. For example, the FSH and E2 level can't be checked on birth control pills. However, if patients are on an IUD, if they have an intrauterine device which secretes progesterone, we can do the process of egg freezing, but we can check a level called the AMH level. So the AMH level is the anti-Mullerian hormone, which gives you an idea of future ovarian reserve. And in conjunction with the ultrasound, and whenever we can do the FSH level, it can tell us how many potential eggs somebody can get at the process of egg retrieval. So once we have the medical evaluation and we see how many follicles somebody has, then we talk about timing. And in terms of preparation for the egg freezing process, I recommend no alcohol, not more than 2 drinks per week, no smoking cigarettes, no smoking marijuana. Marijuana is very toxic for the eggs, so I recommend, if possible, if somebody's freezing their eggs or embryos, to not do any smoking or marijuana for 3 months before the process of egg freezing. And once the process of egg freezing happens, we do a calendar for the patient. So sometimes we take birth control pills to help them with specific timing if they have very intense jobs that they can only take a few days off. Or sometimes we start with a period. When the patient is ready to start with an egg freezing or embryo freezing cycle, we have them call us with the first day of their menstrual cycle. On the second day, they come in and we do an ultrasound. We make sure that there's no cysts in their ovaries. And then we do a blood test and make sure that everything looks good to start. We teach them how to do fertility shots, and either them or their partner or their friends or our nurses can administer these shots, which are subcutaneous medications given under the belly button. And it's either 2 or 3 shots per day that people take. And they come in for about 3 or 4 ultrasounds during a 2-week period to assess how the follicles are growing. So the follicles are the home of the eggs. The more follicles, the more eggs. And we assess the follicles. And when they get to a certain point, we give another medication to hold them from ovulating, called the antagonist medication. And then we continue the medications for a total of 10 days. And when the follicles get to a certain size, for example, about 16 to 18 millimeter size, we do something called a trigger shot. And we have a few different options in terms of different injections that we give to cause these eggs to ovulate. And so what happens when we give the patients a trigger shots, they take a shot 36 hours before the egg retrieval. And then what happens is, in the follicles, the eggs come into the follicular fluid, and it gives us about a 1 to 2 hour window to be able to remove the eggs directly from the follicular fluid by doing an egg retrieval procedure. The egg retrieval procedure is done here at PFCLA. The anesthesiologist evaluates the patient, and the nurses place an IV. Through the IV comes medication that puts the patient to sleep. The medications that we use are called propofol and fentanyl, and the patient sleeps during the procedure, is not intubated, and is able to not feel any of the pain from the needle that we are using to remove the eggs directly from the ovaries. The procedure of egg retrieval lasts about 15 minutes, and during that procedure, we drain all the follicles that are now full of eggs, hopefully. We give all those tubes filled with fluid to the embryologist through a little window, and the embryologist looks through all the tubes and sees how many eggs are in those follicles and tells us the same day how many eggs. After the egg retrieval, the patient wakes up and we know right away how many eggs we have retrieved during the egg retrieval process. And we watch her for about an hour, and then she goes home, and we follow up with her in a few weeks to make sure everything looks good. In the meantime, the embryologist looks at the eggs, looks to see how many eggs, and either freezes them that same day or freezes them the following day if they need to mature overnight. And we let the patient know how many total eggs she has frozen. After the egg retrieval, I usually recommend that patients don't work the day of the egg retrieval. Depends on how many eggs they get. If they have a lot of eggs, if they can take a day off of work the next day, that would be ideal. However, 90% of my patients go back to work the next day and they're able to drive the next day. However, I don't recommend any exercise or sexual activity for about 10 days till their next period, so that we prevent the risk of hyperstimulation getting worse, and also the risk of, more importantly, the risk of ovarian torsion, which can cause twisting of the ovaries if they do activities such as horseback riding or spinning or any kind of intense exercise. Many of my patients ask me, how old do you have to be to freeze your eggs? I usually tell them that if we're born with about 1 million eggs. By the time we're in our teenage years, we've lost half of our eggs. By the time we're in our 20s, we've lost another few 100,000 of eggs. So the sooner you freeze your eggs, the better. What I recommend is after the age of 25 is for everybody to get a fertility assessment, to do an ultrasound and blood test to see how many follicles, what the AMH level, what the FSH level is when available to test. And depending on that, I also ask them how many kids they want. If somebody's 35 and they want 4 kids, well, they better start freezing either eggs or embryos soon. If somebody's 25 years old, then they just want 1 child, they might not need to do an egg freezing cycle until 30. So the younger you freeze your eggs, the better, because they are much better quality and much more likely chance that they are normal. So I usually say definitely in the 30s, early 30s, I think would be a great idea to freeze eggs. There was a study a few years ago which showed that 37 is kind of the sweet spot for freezing eggs, meaning before 37, a lot of patients don't end up using them. After 37, they end up being abnormal. So 37 is like the most cost-efficient time to freeze your eggs. In terms of how long or their expiration date for these eggs that are frozen, nobody really knows the answer, since egg freezing has been around in this country since 2012. In my experience, I have had embryos and eggs frozen for more than 10 years. My oldest egg frozen that resulted in a baby was 10 years. My oldest personal embryo freezing was 13 years. But most doctors recommend that if you can try to use your eggs or embryos within 5 years, that's ideal. In terms of what can you freeze, you can either freeze eggs, sperm, embryos, or a combination. So what I recommend to patients who are not in a relationship is to consider freezing eggs and to consider at some point freezing embryos with a sperm donor. In terms of freezing combination of eggs and embryos, you have to have enough to be able to split them into 2 groups. In terms of freezing eggs, it's just the person's genetics, so they don't have to depend on anybody else to use them in the future. If you freeze embryos, I usually recommend that ideally you want to be in a committed relationship because these embryos can't be used in the future but by the person giving the eggs without the other person's consent. So for example, if somebody is engaged to somebody and uses her partner's sperm and they break up, she can't use those embryos unless he specifically allows her to use the embryos. So it's definitely a commitment for the embryos to freeze them as embryos rather than freeze them as eggs. And so some of my patients freeze eggs and embryo combination. They'll do half and half. In case they break up with that partner, they still have their eggs. And in case they're together, they have their embryos and their eggs. The success of frozen eggs is controversial. The older studies show that in women who are under 40, you need about 14 eggs for 1 baby. The reason being that not all of them survive the freeze. Not all of them fertilize, not all of them make it to day 3 or day 5, and only about half of them are genetically normal for somebody who's, for example, 35-year-old. If somebody's 45, I don't recommend egg freezing. I recommend embryo freezing or getting pregnant as soon as possible. So in terms of how many to have, again, I usually tell my patients a good number to remember is 14 eggs for one baby. In terms of the age, obviously the younger the person is, the less number of eggs. So if somebody's 25, probably 6 eggs could give you one baby, versus if somebody's 40, she might need 30 eggs to get the one baby, just because there's more abnormal eggs at 40 than there are at 25. The great thing about women is that our uterus doesn't age, so that's good. However, our ovaries are aging very rapidly. So a woman that freezes her eggs at 35 and doesn't use them until 45 has the same chance of getting pregnant with those eggs if she uses them at 35 and 45, assuming that there's nothing wrong with her uterus. However, if a woman who's 35 waits till 45 to freeze her eggs at that point, then it's going to be close to impossible to get pregnant with her own eggs at 45 unless she froze them when she was younger at 35. I have a lot of patients who have come to me to freeze their eggs, and when we do the testing for ultrasound, AMH, FSH, we find that they have something called a diminished ovarian reserve, where they have fewer eggs than expected for that age. And so in those patients, we recommend lifestyle modification. We sometimes recommend supplements and acupuncture to see if they can get more eggs, and I've seen 90% of the time that they can improve egg count, especially if they stop things like marijuana and eat a healthier diet. And so patients with diminished ovarian reserve can definitely freeze their eggs. They just might have less eggs at a time to freeze, and they may have to go through multiple egg retrieval cycles to get as many eggs as somebody with a normal ovarian reserve has. In these patients, I also recommend that they highly consider freezing embryos if they have a partner with a partner sperm, or if they have no partner with a donor sperm, so that they can have more chances of getting pregnant in the future.